Hello everyone, I'm Hannibal. Yeah, and I always have difficulties in introducing myself. And I'm studying sociology currently in Goethe University in Frankfurt, and in my master program. And yeah, I think that's it. Oh, and I'm a trans man, so I use he, him, or they, them pronoun. And yeah, today I just want to give you a very brief introduction of medical regulations related to transgender in mainland China. So yeah, so first of all, I wanted to start with some definitions. Well, yeah, so maybe these definitions could also answering some of your questions before. Yeah, so first of all, like according to the United Nations Campaign for Freedom and Equality, that gender identity refers to a deeply felt and experienced sense of one's own gender. So everyone has their own gender identity, and it is one of a person's various identities. So the vast majority of people consider their gender identity the same as their gender assigned at birth. So such people could be referred to as cisgender people. And the next is gender, actually, yeah, we started with sexism but at birth. So and gender expression refers to the external manifestations of gender. So it could be expressed through a person's name, pronouns, clothing, and haircut, voice, and or their behavior. So yeah, I think this could also answer the question that you have before, like why did they choose to express themselves like more like in a sense of traditional women's clothes. So I think that's it it's not depend on your gender identity, whether you choose to like identify yourself as man or woman or non-binary people. You can express yourself in any way you like. It doesn't matter that it's not dependent on your gender identity. So um the term transgender was actually coined in the English-speaking North American gender variant community in the mid-20th century, and it became widely used in the mid-1990s. And it is an umbrella term that encompasses not only people who want to make change through medical treatment so that they can live more comfortably with the gender they identify with, but also people who want only partially medical treatment and those who do not want to have any surgery or hormone therapy. So well, it could also refer to people whose gender expression does not conform to social expectations on the gender norms of their sex assigned at birth, or people who would like to challenge the conventional binary classification of gender. And yeah, and some active sexual minority rights organizations have called for transgender to be used as an adjective and rather than a noun or a verb, as adding the article like a transgender or the suffix transgendered. So to the word, this could carry the false implication that people must have experienced something to choose to be transgender. So, and some other scholars, such as Jack Haberstam, prefer to use trans with the asterisk to make this umbrella term more inclusive. And because this term does not simply refer to a fixed and proposable endpoint. So together with the asterisk, it also embraces the exploration and uncertainty of one's gender identity. So, and also one's body, and it is always under construction. So it's not a fixed and end term. And well, actually, I didn't put it in the slides, but some of the most common subcategories of this trans umbrella term could also be like drag king or drag queen, which usually refers to a performative practice that expresses masculinity, femininity, or other gendered expressions. So and also maybe a cross-dresser could be also part of this umbrella term, which refers to a person who prefers to wear clothing that is considered to belong to the other gender, in terms of the binary gender expression, and who does not necessarily question their gender assigned at birth. So, well, yeah, there could be also terms like non-binary people, which refers to people whose gender identity falls outside the male or female gender dichotomy. So, and there could also be gender non-conforming people, which refers to people whose gender expression is neither masculine nor feminine, as expected by conventional society, which could be unrelated to a person's gender identity. And yeah, so. Okay, yeah, I put this in a line. So the part above is the regulations in China, mainland China, and the bottom line are the regulations like international. So like before the first CCMD, first version of CCMD, there was no official regulations that related to transgender in China before. So like the CCMD was referred to the ICD-9 in which was published in 1977, and the transgender people, which was called sex changed people in the regulation, and it was under the category of psychosexual disorders, and there were several subcategories that could refer to transgender people that we understand today, that, and they will be the cross-dressing addiction and transsexual addiction, and also disorders of psychosexual identity. So, and then like after the publishment of the ICD-10, it was actually a draft of ICD-10, and in the ICD-10, the transsexualism was like under the gender identity disorder, and there was also a dual role transvestism in this regulation, and yeah, the gender identity disorder of childhood and the fetishistic transvestism was also in the ICD-10. So referred to the ICD-10, the mainland China has published the CCMD2, but it actually didn't change much things. So the transgender people were still under the psychosexual disorders subcategory, and yeah, they still using the sex changed people to refer to transgender people. And yeah, and then in 1994, actually in American, the DSM-4 was published, and they refer to transgender people in the category of gender identity disorder. And so, well, after that, yeah, there was an updated version of CCMD2, but the contents related to transgender was actually didn't change. So then it comes to the third version of the CCMD. It's the, yeah. So transgender people is like under the subcategory of sexual identity disorder and transsexual disorder and like cross-dressing disorder. So in this regulation that they like finally changed the term sex changed people, but into transsexual people, and they refer to them like as they are having transsexual illness. And then there was a technical management specifications for the actually the gender reassignment surgery, and they refer to as sex change surgery. And I will share the like more detailed contents of this technical management specifications later. And so like in 2013 there was a DSM-5, so like transgender people was covered in the gender dysphoria. And like in 2017 there was a new specification for the surgery, but they're still using the pathologized terms, and they actually didn't change much things. So the newest updated version internationally is the ICD 11. So in this regulation, actually transgender people are depathologized, and it was subcategorized in the gender incongruence. And finally, like 2 months before, in mainland China, we have a new clinical application management specification for gender reassignment technology. So they finally stopped using sex change surgery, and they changed it into the gender reassignment surgery, and mentioned transgender people not as much as an illness or things like that, like before. So I want to share this diagnostic criteria in CCMD3 because although like a lot of doctors and their associations are promoting to use the newest international regulations of ICD-11 to make diagnostic things, but actually the Chinese own specifications, this CCMD3 is still in use. So I want to introduce this to you. So if people will be like diagnostic as sexual identity disorder, they have to have the persistent and intense distress over being female or male and the desire to be the opposite sex. And this desire should not stem from any cultural or social benefit. And in this CCMD3, they also have different criteria for people who was assigned male and who was assigned female at birth. So I've listed the criteria here. So for people who was assigned female at birth, they have regulated that if she obstinately expresses her aversion to women's clothing and insists on wearing men's clothing, or if she obstinately denies the female anatomy and like explicitly stating that she has or will grow a penis, or being unwilling to urinate in the squatting position, or explicitly stating that she does not wish to develop breasts or experience menstruation. And for people who was assigned male at birth, they have stated that if he focuses on female routines, such as preferring female dress or participating in female games or recreational activities and refusing to participate in male routines, or if he obstinately denying the male anatomy, and as evidenced by like assertions that one will grow into a woman not only in terms of roles or clear expressions of aversion to the penis or testicles, or believes that the penis or testicles are about to disappear, or preferably not. So yeah, I've highlighted these words that they didn't explain anymore in red color, like which we could see like what is women clothing and what is men clothing, and like what is female routines. They just didn't give any explanation about that. Like what is a female game? Can you imagine? So like and here like, so they stated that they shouldn't like feel to be like a woman in terms of roles. Like they didn't explain anything about what is a female role. So there's a lot of problems in this regulation, and the yeah, the biggest problem is this is still in use. So um even if there are some very progressive and very friendly doctors in China, they would use the ICD-11 as the criteria for diagnostic. But actually, for the majority of the doctors in China, that they don't have, they didn't have any like knowledge about transgender, then they could just use this criteria as their as their words to say you are not like this, so I cannot make this criteria for you, like you are not transgender. So yeah. And yeah, there are also two other subcategories which could also be related to transgender people, which one of them is transsexual disorder, and the criteria states that to be diagnosed as a transgender disorder, a transsexual disorder, these people have to have a rebellion against one's anatomical sex, and a persistent aversion to one's own sex, and a desire to change to the anatomical features of the opposite sex. And the identification with the opposite sex should have lasted for at least 2 years. And the sexual orientation of a person with the transsexual disorder is purely homosexual, heterosexual. This is very, yeah. And yeah, this is very like, doesn't make any sense. Like, yeah, so you can see, as you can see, this is the criteria was created on the very binary gender system, and also a heteronormative system. And for the cross-dressing disorder, like they even have a very like paradoxical criteria, states that, well, the description of the cross-dressing states that the patient does not require a change in the anatomy or physiology of their gender, yet the diagnostic criteria states that they have the expectations of permanent change to the opposite sex. And so here are the informations about the evolution of the 3 surgical specifications. And in the very first specifications in 2009, so they have requirements for the documents, like if you want to have the surgery or other like hormone treatment, you have to hand out the certificate of no criminal record and a certificate of diagnosis of transsexual addiction and proof of no other abnormal mental state and no other psychopathy, and also proof of heterosexual orientation, and a report of the person's request for surgery and a notary certificate of it, and the proof that the patient's immediate family knows about their surgery. So as you can see, like many things has remained the same till today. And in the 2017 version, they have changed the terms from transsexual addiction to transsexual illness, and they removed the requirements for proof of mental states, psychopathy, and heterosexual orientation. And in the very newest version, they have changed transsexual illness into transsexual disorder, and they have added gender dysphoria and or the gender incongruence. And in new version, they have also removed the requirement for notarization. And they also have the regulations for the hospital management, that in the very first version, the hospital can only issue a medical certificate after the completion of the external genital reconstruction surgery. And nowadays, they've said, well, the hospital can issue the certificate after the completion of the genital and gonadectomy surgery. So, and they also have requirements for patients. So in the very first version, the patient's need for sex change must last for at least 5 years and must not be reversed in the middle of the procedure. And well, you can see this remained the same. And the patient has received a psychological or psychiatric treatment for at least 1 year prior to the surgery, and the treatment, they have to prove that this treatment has been ineffective. And this regulation is like totally removed in today's regulation. And the third, the patient is, they have to prove that they are not in a marital relationship, and this remained the same. And in the very first version, that they have the extreme restriction on the age. So the people should be over 20 years old, and actually you will be an adult at your age of 18 in China. But so I don't think this regulation was making any sense. And so in the very newest version, they have finally changed this into the 18 years old. And the final regulation that said there were no contradictions to the surgery, and so they have added something in newest version that requires informed consent from the subject of the procedure regarding the purpose, risks, and the consequences. So, as for me, there is a lot of progressive changes in the version of this year, but still there are still a lot of problems that, so Yeah, so this is my last slide of my presentation. So yeah, nowadays the transgender people, the community are still facing a lot of problems and difficulties, and yeah, they're lacking of medical resources. There are just like you can count in one hand that hospitals in mainland China, which could support, could be friendly to transgender people and could provide the medical treatment for them. And there is also the imbalance of resources among regions. So yeah, most of this friendly transgender friendly hospitals are in like Peking, like in Shanghai, but for people who are from small cities or other regions, it could be very difficult for them to get access to the resources. And still, I think there's another big problem of parental consent. So which means there was a regulation about like so if you want to have medical treatment, your immediate family, they have to know about your decision. They have to know about your decisions on surgery and everything. So this parental consent has no upper age limit. So if like if you are 60, so you still have to ask your 80 years old parents to know about your decisions on your surgery and everything. So yes, this remain the same. So this could make big problems for many people to get access to medical treatment because they will never get the parental consent from the parents. So that was also the reason that many transgender people they have to choose the hospitals or clinics which actually don't have any certificate to doing such surgery. So yeah, so or buying the hormones from people they have no idea about. Yeah, so that could be very dangerous. So you don't know what you're getting from. So what you are getting, what you are injecting in your body. So this could be also very dangerous. And yeah, so in the current still effective regulations, it is still like constructed in a very binary gender system and heteronormative frame. So I've heard a lot of stories from the community that's saying that so like if the person is a trans man and he's gay, so he's not heterosexual, and so it's like if they want to get some this certificate from the hospital, sometimes they have to pretend they're heterosexual. So that could be very ridiculous. And yeah, so that is also the status quo of transgender people in China right now. And yeah, although the discourses and the regulations are changing a lot from the sex changed people from the very first regulation into now they're using transgender people, but still the discrimination, stigmatization, which are coming from such regulations are still damaging the community. So as you can see, whether the regulations is changing or not, so it could not have a very efficient and very rapid change in the everybody's mind. So there will be still a long way to go. So that's the all the information that I want to share through the slides. So yeah, and if you have any questions about like basic questions on transgender people or maybe the status quo of transgender community in mainland China right now. Yeah, so maybe you could ask.
Is there any question?
So my question was how to find information on transitioning in China, if it's easy to find or who to ask, and how you would be informed about also which kind of hospitals are safe or considered safe.
Yeah, thank you for the question. Actually, I did this research during my bachelor studies, and yeah, so as transgender people or also non-binary people who want to get access to such treatment, medical treatment, nowadays there are like quite a lot of information on the internet. So it was provided by the LGBTQ community and organizations in mainland China. So there are several like transgender specific organizations also in China. So they are providing the specific information for like in every regions, and like in maybe a lot of cities they have listed all the friendly doctors and who you could ask for help and everything. So if you wanted to get access to such information, you can just search it online. So yeah.
Hello. So recently there was the anniversary of Stonewall riots again, and because like the roots of the it's already in the name. It was a riot, and I wonder whether like activists or like queer activists or trans activists in China, like from their strategies, maybe also employ some more militant. If was there some usage of militant tactics like riots or so? I was interested in that. Maybe you can. Yeah, whether there has been some usage of militant tactics.
I'm not sure. Well, thank you for the question first, but I'm not sure if I understand your question correct. But yeah, if you're asking about strategies they're using right now, okay. So actually, I don't.
No one is afraid.
I am afraid because we're also online.
I'm not sure whether you're asking about militant. Can you really explain that, because English is not our mother language, so I don't know whether maybe he cannot understand what you're talking about.
Okay, for example, like I feel like sometimes there are different ways of for example, one way of doing things is like to say like, okay, see, I'm a human too, and I also suffer. And so, but like another more like a different way would just be to say, okay, if you're not going to listen to me, you will suffer because I'm gonna hurt you or so. Or for example, in the riots, the like the activists like Sylvia Rivera and Marsha P. Johnson, they started to attack the police. They threw bottles at them, and to say like, okay, we're not going to take this anymore. And yeah, this is what I mean, for example, with like militant tactics. And yeah, I was wondering if, because I haven't heard of these things before, and maybe they exist, but I haven't encountered it.
Okay, so yeah, thank you for explanation. I understand it, but I don't think I can give you a proper answer for this question because I'm right now I'm doing volunteering jobs in the Chinese LGBTQ organizations, but they are under severe like censorship and everything. So I couldn't give you a lot about such informations because we are only we're also like screened online. So and like yeah, so
Maybe we can talk about it later.
yeah,
Without
so
online.
it's for the safety reasons and everything. Maybe you could understand. So we could talk about this later, maybe.
Hi, I wanted to ask about the medical situation. So you mentioned that if there's no way for people to access the treatment they need legally, you mentioned that there are usually ways, well, like people are, they find ways around that and access it illegally. I wanted to ask if there's any like legal prosecution for that, and if there's also discrimination still in the medical field, like after surgery, or if like doctors notice that they've gotten this treatment from probably an illegal source, or at least they can't prove that they've gotten it legally. If there's like, yeah, if there will be doctors who refuse treatment and that sort of thing. Also, thank you for like compiling all the information. It was really interesting.
Thank you for your question. Actually, yeah, I've heard about a lot of yeah from the community that they're saying that although they are visiting the doctors on the friendly list, but still, yeah, as the regulations is still on the heteronormative system and everything. So, like for transgender people and non-binary people who are not um like who are not identified with this whole binary gender system and this heterosexual orientation thing. So if yeah, the situation could be like if they said that I identify as a trans man, but I still love men. So this could be like making nonsense for the doctors. So they could think that, oh, then you might should consider this again. So whether you are transgender people or not. So and there are yeah there must have a lot of discriminations like in hospitals because such friendly hospitals you could like only find it in such big cities. So for the majority of the people from other regions, they like they cannot afford a ticket to such a big city, so they have to ask local hospitals. But as I said, the doctors there might have they know nothing about transgender people, so they they could abuse them verbally and like everything. So bad things are happening like right now. So yeah, it's frustrating, but it's yeah.
So I wondered if you talk about the medical regulations, whether the doctors they could feel anything, well, if they could create such a thing called empathy. Because, well, as for the other people, for instance, the people who are unable to see, you have many places to, well, for the normal people, for the people who are able to see, to, well, to live a life maybe for 1 hour or 2 hours, or maybe for a day. for the blind people, or pretending to be the blind people, and then they will know the problems the blind people would occur or would encounter in their life. So there is such a place in Hamburg, and I think you can find such place elsewhere. So you have to cross the street without seeing anything. You can only hear the sound, and you have to use this kind of stick to go on. As a matter of fact, I fall down 2 or 3 times. And well, at that time, I started to know how was the life, or how would the life be for the blind people. I wondered whether whether the doctors could well express or know anything about well, from your perspective, because apparently, according to your story or according to your interpretation, there is no way for them. They will just say, well, they need medical treatment, but they cannot have any sympathy, or they will create an elusive, which is lack of sympathy. So I think this could be a really serious problem.
Okay, so thank you for a question. I think I wouldn't say that like every doctors could not have this empathy with transgender community. So as you can see, we have the very newest regulations was published 2 months ago. So and there are a lot of progressive changes. So yeah, there are lots of people, activists in China. Yeah, they are working on communicate with doctors and also the associations of them. So they're working on like right now to express their difficulties inside the community, and how difficult would it be for transgender or non-binary people to get access to such medical treatments. So I think the communication is always there. So but yeah, we have to yeah, like we have to work this with the help with the like 3 or 5 very friendly doctors together, so we could make such change. So I think this is still in progress, and yeah, although it could be very difficult, but it's still work in progress.
So perhaps a very personal question. I think, well, in the future, you can become such a friendly doctor who comes from this transgender group, and I think this will be very helpful.
Yeah. Yeah, but I'm studying sociology, so I cannot be a doctor. Yeah. Thank you for your question. Yeah, so yeah. Well, thank you for the question, Bella. I can actually, I do have some information about the public accounts on WeChat, but yeah, maybe I can send people who are interested later, but I cannot speak it out right here because yeah, out of safety problems. No.
I know Bella. I can see her plenty of.
No? All right. So I wanted to ask if like these friendly doctors that you mentioned in China, whether they face anything similar as like those abortion doctors in the US. So like, is there backlash from the society towards like them providing that sort of treatment? Or is it that like the general society just kind of ignores trans people and so therefore doesn't cause any issue until trans people become visible?
Thank you for a question. I'm not sure if I understand your question correctly, but there are lots of like quarrel from the parents of transgender people and non-binary people, like in the hospitals between the parents and the doctor. So they are, yeah. So the parents might be like wanted to persuade them to persuade the doctors that their child is not a transgender people. So there are lots of like argues and everything could be happening inside the hospitals, and yeah. And yeah, maybe we could talk this later, because yeah, I actually I have a lot of information on the hospitals and also maybe the doctors and like stories like between the communities and doctors, but yeah, so yeah.
So I have one more question. So I don't know if some of you are aware of this word 药娘 in Chinese. Basically, it means so for some trans men, they want to seek for medical treatment, but they're not able to find proper medical treatment suppliers. So they have to go to some illegal channel, like on some, I don't know, black market or something like that. Then they get this kind of illegal treatment from those channels, which might actually also pose some risks in their own health, and also I think cause quite a lot of uncertainties and just risk, dangers on themselves. So I also know that I think in China's society, there's a lot of stigmatization around such word. And it, like whenever it comes to transgender group, there's always a very negative connotation to those words. And I was wondering, what is your take on that one?
Yeah, thank you for a question. And first of all, this 药娘, this term is referred to trans women. It's not trans men. So yeah, trans women is people who was assigned male at birth and then identify themselves with female later. So well, actually, for myself, from my personal point of view, I don't have much knowledge on the like the specific medical treatment for trans women, but yeah, I've also been in some group chats which contains like trans women, trans men, and non-binary people and everything. So yeah, there I've seen that like not every people would feel comfortable with this term, like yeah, like how the negative connotations that you've mentioned to the behind this term and yeah, everything. So yeah, I don't think it's like quite positive or neutral term for referring to such people, but yeah, there are also people who would refer to themselves as 药娘, but yeah, I personally I didn't have personal contacts with such peoples, and yeah.
Thank you. We have another. Okay, I'm gonna read it very loud. May I ask for your opinion on the growing turf population in China in recent years and how serious with its negative impact on the medical process for the trans community. TERF. If anyone doesn't know something about TERF, maybe he can explain a little bit.
Well, this could be a very long story. So for you who maybe don't know what TERF is an abbreviation of trans exclusive radical feminism. So I don't want to like define TERF. Yeah, you're right, exclusionary. Yes, sure. Yeah. And I don't want to define them. Like, but yeah, there are a lot of like argues and blames from the TERFs group on transgender community, like for instance on the bathroom using, or the athletes, whether transgender athletes could attend sports and everything. So certainly I wouldn't agree with opinions of TERFs, of course, but I'm sorry, what was the question that like oh well, so like for instance, there was a news like was spread very widely these days, like yeah, 2 weeks ago. Like if you maybe you know that there was a transgender child who is 17 years old and American. So they were regretted like after the transition, after the hormone therapy and everything. So in the like in the simplified Chinese network, there was a like a huge debate on this news. So saying that look, they feel regret about it, so we shouldn't promote any like treatment providing for transgender community. So uh, yeah, like eventually they will regret something like that. So I was like who could live a life without regretting anything? Like it's none of your business. So so they're making this huge news about transgender people, like trying to stigmatize their gender identity and trying to deny their gender identity and everything. So I just don't feel right about this. So like and there is also like debates on whether the transgender people could use the women's restrooms like all the time on the internet. So I mean, like from my personal perspective, like transgender people just want to use the bathroom. Like you cannot blame transgender people for people who are pretending to be women or to be men and to wanted to do some sexual assaults in the restroom. You cannot blame transgender people for this. You should blame people who did the crime. So I think many opinions of from the TERFs or any other people that they just keep blaming transgender people for this. So I don't think it's fair at all. So yeah. Am I making sense?
Yeah, it's what you brought. Sorry, it's what you brought up to. It's like this common thing. It's like the point of detransitioning that happens to children and anyone who starts HRT on his own. There's like a 1% detransitioning rate amongst all trans people. This is a fairly low point. And additionally to that, the people who had unreversible conditions from HRT from the people who detransitioned are like 1% from 1%. It's like extremely low because when you start hormone replacement therapy or going through a transition, all that medical stuff, everything is 100% reversible. You can stop any day. The only thing that is not reversible is like the biggest bottom surgery or some top surgery for trans men. Anything beside that is reversible. So there's no point or no fear in detransitioning. You don't ruin anything. You don't get to a point where you can't be who you are, because life is about change and you can always change yourself. This is an important thing that people seem to miss, especially like turfs, I guess. This is like it's really stupid to think about it. And the other point about this whole bathroom debate is sometimes I don't feel well about my womanhood. And I started to go when I don't feel well about it, and I have to go to the toilet and there are only gender toilets. Like last time I went to a man's toilet and there were like two dudes on the pissoir, and we both freaked out because they really started blushing, and this is something I felt in this point really uncomfortable because I made people uncomfortable by them seeing a woman in a man's room, because this is a concept that people don't seem to grasp. And I felt really, because people started to make me feel bad about my gender. So I started to make other people uncomfortable. So this is don't let you push into a place where you don't belong, because it's really far from how reality works. Reality usually don't work like that. And to that point of sexual assaulting, it's always for some reason trans women who go into women. It's not about trans men going into man toilets to assault. You can do it beside your fucking gender. I mean, it's a really stupid concept. If I really want to assault a woman in a public bathroom, it doesn't even matter if I'm a man or a woman, because I really want to do it. I just go in there and like do the crime. I mean, this is something ridiculous. I don't go through years of medical surgeries and medical assignments and all that psychological stuff. I changed my name, changed everything around me, all my social network, all my my workplace. I have to go all through this just to assault a woman. I mean, make it sense. So that's something that I never can get. I mean, I don't know. You can do it beside your gender. You don't have to change it. And if you really want to, really badly, I don't do it, but you can. It's the terrible thing. I don't know. So this is what I want to put beside that, because I think it's really funny. Or it's not funny. It's the irony, I guess. So thank you.
Yeah, thank you for sharing. I really can relate it a lot. Like, yeah, as a trans man, most of the time, like at the campus, I will use the male bathroom, and yeah, sometimes I will also use the female bathroom. And when I like, oh, I think I want to use the restroom, so I should prepare myself mentally first. Like so I stand up, like like 5 meters from the bathroom, and I watch if there will be anyone like there, if there would be a lot of people in the bathroom. So I watched like for a few seconds, and oh, it seems that there are not much people. So I decided to go, and like yeah, like last week I when I like after I decided to go to a male bathroom, and I opened the door, and it seems that there was no people in the bathroom. So but it was a new bathroom I've never been to, so I don't know where the straw is, and so I went further. So there was facilities for urine for male use. So, and I don't know the name of it, but yeah,
Separate rooms in the men's bathroom.
no, for standing to pee. The places.
That's very cute.
Yeah. So I went further, and I find there was a guy standing there. So I like immediately went backwards, and so yeah, because the separate rooms was the two. Yeah, the two separate rooms were full at the time. So I went further, and there was a guy standing there. So I went back, and so I waited for the separate room, and then I find one of door. It seems it was closed, but it was actually open. So I thought, oh, there must be no one in there. So I pushed the door, and there was another guy standing and peeing there. So I was like, oh, I'm sorry. And after saying this, I'm sorry. And then I realized, oh, my voice was too high. I didn't sound like a man. So I didn't sound man enough. So I start to panic a little bit. So I went backwards again. So I waited outside the separate room. And so I waited this guy finishing and went to wash his hands. So I like rushed into this separate room and locked the door and finish my thing, and then I stopped. So I tied it up and I stopped. So I like sit in the separate room. I wait and I listen again if there is anyone like walking inside this bathroom. So I listened and I waited. So oh, I hear the guy inside was gone. So I then I prepared to go out, but then I hear another guy coming in. So I stopped and still and keep waiting and keep listening. So like after 3 minutes, finally there was silence. So finally I decided to go out. But like when I opened the door, I like two guys stood in front of the separated rooms waiting for using this. So I was like, so I pretend to be like looking calmly and wash my hand and rushed out of the restroom. So that is the reality of a transgender people using bathrooms. Yes. So about the people who don't express them in a traditional binary gender expression way. So yeah, not only a problem for transgender people, for sure. Yeah, so that was my experience last week. So
Okay, now we have I don't want to put you away from it, but I think you brought up a really interesting point from a psychological point, like all those horror stories that are made up of transgender people going into public restrooms to, I guess, okay. All the horror stories about transgender people going into public restroom to cause havoc or something. It's like it's about control, because your gender, the man who you are, or who you want to be, or how you desire to be, was never a problem, but it was a made-up problem in your mind, because this is something. It's about control, where they always put these thoughts on you, so you are the one who put yourself into a place they wanted you to be. And yeah, this is what I wanted to put, because if you never brought up this "I'm sorry" or panicked or something, there will never be a problem about you being a man to go into a man, like, okay, man place, I guess. And yeah, it's about control, and so you always have to look at what is reality and what is like, I don't know, propaganda is like the wrong word for it, but what is just like radical people trying to, I know the German word, diffamieren, like to put okay, I guess the only German person in the room, I guess, but I'm not also not born German. I don't know, I guess. Sorry for that. Yeah, what they want to degrade you to a point, because they want you to stay in your gender, and so you have to be your own god into your mind. This is what they want. They want you to always be judgmental about you and always have to prove your gender. And this is yeah, this is about control. So this is what I wanted to say. And yeah, thanks.
Don't have any questions for and if there's any question from online meetings, the last one maybe no.
Thanks. I'll try to keep it short. I was just wondering, because we talked about a lot of physical medical regulations. Is it common in China that you also get support through somebody that is a mental health expert that will support you during the transition? Or are people more alone without the mental health support?
Yeah, thank you for your question. Yeah, there are like lots of therapists who yeah, stating them as transgender friendly and also LGBTQ friendly in mainland China. So yeah, so you can't get access to such also like mental health resources, but yeah, the problems remain the same. So there are still like we are still lacking of such resources. So and you know for yeah, there is not much like such mental health resources that you can get it free. So you, even if there are such resources, you have to like pay like per hours and everything. So yeah, it's not for everybody for now. So I think there are lots of activists are working on it, but still a long way to go.